I am a neurologist at the Michael J. Fox Foundation for Parkinson's disease. I want to help you understand more about this disease and talk about a case study that might provide answers for this disease. Early symptoms of Parkinson's disease begin with tremors on one side of the body. As the disease progresses, a stooped posture forms, a shuffling gait, bradykinesia, akinesia, balance issues, and inability to move rigid limbs are other signature symptoms. Other symptoms include depression, mood changes, personality changes, sleep disturbances, dementia, speech impairment, sexual difficulties, and loss of smell. Parkinson's disease is rare and affects about 3% of the U.S. population. There is currently no treatment for Parkinson's disease. For stage 5 Parkinson patients, carbidopa levodopa is used for palliative relief. Surgical procedures to stop uncontrollable movements using deep brain stimulation via implant are also an option, however last resort. Physical therapists, occupational therapists, and speech therapists help with symptoms, allowing individuals to cope with everyday tasks. For preventative measures, exercise and healthy diet are the best way to combat Parkinson's disease. Typically, a patient is diagnosed around age 60 or older. Parkinson's disease is not a fatal disease. On average, the patient's life expectancy is about the same without the disease. However, life expectancy is about 10 years. I diagnose about 100 patients of the 2,000 patients per year with Parkinson's disease. Let's look at a recent patient of mine. He is 62 years old, a male Caucasian. His mother was also diagnosed with Parkinson's. He was diagnosed at age 57. He is currently at stage 4 and sees a physical therapist about 3 or 4 times per week, as well as a psychiatrist and speech therapist. Treatments are used to help with daily living. As he speaks or walks, the tremors are more apparent. He shows no sign of mental deterioration, apart from occasionally forgetfulness. Maintains a proper diet as well as exercise prescribed by a physical therapist. By observing his CT scans from his first diagnostics and more recent scans, we have found that the substantia nigra and the corpus striatum has decreased activity. These areas communicate to create smooth movement of muscles. Dopamine, the neurotransmitter levels, have also are decreased. Carbidopa levodopa is a common drug combination to cope with the low levels of dopamine. For severe cases, an electrical implant via craniotomy can help reduce tremors. It is important to understand this rare disease has no cure. Along with loss of low dopamine levels, it can be difficult to cope with the loss of function and cause depression. Providing them with hope and the means to continue living a full life is among the most helpful ways to combat this disease. As we look for cures, the best preventative measures are exercise and healthy diet. Help them find the local support groups to put them in contact with experienced healthcare professionals such as yourselves. We do not know why brain cells are deteriorating. Using cerebral angiography, we have found Lewy bodies containing protein alpha-synuclein are often seen in patients with Parkinson's disease. The 5 genes are linked to Parkinson's disease: the SNCA, PARK2, PARK7, PINK1, and LRRK2, which all require more research.